Hi, I'm Alice Hart-Davis from the Tweakments Guide, and today I'm at the S-Thetics Clinic in Beaconsfield, where I'm going to meet Miss Sherina Balaratnam. Now, Sherina trained as a plastic surgeon before moving into non-surgical procedures, and today she's one of the UK's elite. This year she was voted Aesthetic Medical Practitioner of the Year at the Aesthetic Awards, which is a huge deal. So what makes her so good? Well, she gets brilliant natural looking results with her facial rejuvenation work, but she also does a lot of body treatments too, and she's got some very interesting machines here. And I want to go and find out about everything from the skincare to the body sculpting. So come along with me and we'll see what we find. I wanted to ask, what is it that brings people in here in the first place?
Thank you, Alice. Well, first and foremost, patients come to us with hope. Patients come to us with concerns, and they come wanting results. I want to deliver our patients results that they can see, feel, we can track, we can measure, and ultimately we can celebrate together. I think the key thing about being a patient is, in this new age of aesthetic and regenerative medicine, it's an exciting space to be, for me as a doctor, for us as healthcare professionals. For a consumer, or maybe even a prospective patient, it can be highly confusing. So this is Alison, and it's been fantastic actually working with Alison as a patient, and this is her Visia pictures. This was on the right, which is today, and on the left is actually on the 20th of February 2018. As a patient, we can only see ourselves, or a human being, we can only see ourselves in 2D, whereas this is actually going to be able to visualize ourselves from what other people see ourselves looking like. So we're looking at a 4.5-year picture.
Wow.
Yes. Well, firstly, I look for, does it look better? Yes. And I'm going to say that for 4.5 years, I would naturally expect 4.5 years of aging. I don't see that. I actually see a more youthful person. More importantly, I see a more healthy person as well. I see bounce of light off your skin. That means that your skin is high performing, it's actually functioning well, it's actually behaving a lot better than it used to as well. And then finally, look at even things like the contours in your face. You've got a lot more structure to your cheekbones. Bearing in mind, I haven't touched you for years.
No.
You know, so that comes with your skincare, your high-tech facials. We've done some strategically placed injectables probably about 3 years ago now, and look at how far that's actually taken you. So in some time and shape, we all need those facial contour injectables to get the cheekbone, get the temples, get the forehead, and get that lower face back into play again.
But once they're in there, they can last a really quite a long time, can't they?
Absolutely.
You're one of the UK's elite practitioners when it comes to injectables, and restructuring and replacing volume with injectables. It's something that terrifies people, but if you can show them with this machine what's happening in their faces and explain how you go about addressing that, that must make the whole conversation easier.
It certainly does. And again, it's an educational process. It's very similar to, take my house for example. When I first bought it, it was beautiful. But there are certain structural things about it that we had to tweak and optimize in order to have a more satisfying life ahead of us. So when I think about that way for me, and how I'd like to be treated during a consultation process, if I'm educated and I understand what is going to happen to me as I naturally age, then I will understand actually there's a semi-predictive way, which is not just pulled out of a hat. It's scientific, it's measured by CT, by MRI scans, by skeletal imaging studies, and there is so much knowledge and information coming on the genetics of aging as well. We're learning so much more about epigenetics, lifestyle influences, these little snackable changes that we need to incorporate into our daily life. So I think if things are semi-predictable, we should be able to really be a lot more dynamic and strategic about our aging process. So I always say to patients, look, do nothing is always an option. This is the other end of it, and what we do lies in the middle.
It always strikes me that you choose really thoughtful, sensible devices and treatments to have here. I mean, there's no gimmicks, are there? Everything is very well researched and evidence-based.
That's exactly it. Everything is evidence-based. They're peer-reviewed publications. They're highly scientific, and they're reproducible. They're innovative. There's constant data coming out. There's a lot of investment in technology and research as well. That's pretty much what I go for.
Now, you've got regenerative medicine on offer here, haven't you, as well?
I do. Yes, we do. And I love the regenerative therapies that we do. Everything that I've learned from my past working for military burns consultants has always been about tissue regeneration, has always been about wound healing. What can we do to get that patient to heal well. That's pretty much it.
Okay.
So when I think about things like our Saluma light therapy, that is a form of regenerative therapy that
Yes.
patients can have in the comfort of our practice after their high-tech facials. And a lot of our patients actually take that light therapy and actually take it home.
Because the Saluma is the highest grade medical light therapy. I mean, it's really proven for stimulating the skin cells into regenerating, isn't it? It's not just a nice thing to lie under. Yeah.
And I think that's the misconception about light therapies. Is it just a blue light? Is it just a red light? Is it there to make us feel good? Sure, we're going to go outside, we're going to lie in the sun, we're going to feel amazing, the dopamines are released and so forth. However, flip it to a concentrated light of a known wavelength that's going to get to a target. Blue light to the sebaceous oil gland to target bacteria. Red light, the layer below, to target your redness, your inflammation, your collagen stimulation. And now we have targeted near-infrared light that can go all the way deep through the skin to actually wake up the mitochondrial of the cells. And these are clinically proven. There's 9 FDA clearances behind that technology right now.
As part of the regenerative, I can't say it, as part of the regenerative therapies that you offer, you've got PRP, but you've also got a kind of PRP plus, haven't you? What's that?
I love that. PRP plus, yes. So PRP has revolutionized so many things nowadays, from orthopedic surgery, from other forms of surgeries, but also now coming to this practice also for blood therapies. When I think about the type of PRP now that we have, it comes with something called hyaluronic acid, patented, called the cell matrix. So this is part of a new treatment called the Regen Lab centrifugation system.
Yes.
Yes.
So you take blood from the patient, you
Correct.
centrifuge it, and then do you add hyaluronic acid to it?
It's built in.
It's built in.
It's built in, Alice. So it's never been done before. This is patented by the company. And this is what makes the science so special and so unique, because it's coming very new into our space. It's already in tissue regeneration labs, well, now it's actually able to come into our space.
Goodness.
So we can offer this to our patients and they will see so much more. They will get accelerated wound healing. And when I talk about wound healing, there's nothing wrong with the patient. But with some patients, we're doing collagen induction therapies. We're doing microneedling. We're doing radiofrequency. We're doing skin pen. That's another collagen induction.
Sure.
We're doing lasers. And whether it's with the technology or on its own, we can get more addition of hyaluronic acid, more moisture.
That will just amp up all the remodeling of the skin that's going on, won't it, by providing extra hyaluronic acid, by providing those stimulating growth factors and whatever you get in the PRP.
Precisely.
That's going to have a synergistic effect, I think is what I'm trying to say.
Absolutely. So this is the secret sauce. So you have the patient's magic blood, you have the secret sauce, which is a 20 milligrams per mil of HA, the white buffer in the middle, which is a separator, and we're going to spin it down just to blend it all together. So this is, again, a great concept of what I call treatment blending.
There we go. Okay. And it's done. We see the plasma.
There we go.
Totally
Beautiful.
separated. Red cells, the separator, and clear plasma. At the top, at the moment, you still see the hyaluronic acid, and I'm now going to mix the two
Mix it
together.
together. Nice. So you can actually see and appreciate how much thicker it is as well. So think about a gel of hyaluronic acid, which is this, but what you now have is the patient's own blood therapy mixed into the gel. So when you're injecting conventional PRP, it's practically like water, so it feels very different. When you're injecting the PRP cell matrix, you can see it's slightly thicker. So when you inject it under the skin, you can feel it a little bit as well, but that's where you get the real bang for your buck. So this is a very special solution.
So now it's all mixed and still the cells are separated.
Nice.
Yeah?
Got a little stretch. 1, 2, 3. All okay?
Yeah.
Okay. And that's great. Can you see that the brow's gone up a little bit? And here where you've got concavity, can you see how there's a lot more smoothness in her transitions? And if you can see, she's got what we call eye bag there. It looks a little bit flatter. And if you can see here, she's got a deeper nasolabial. It's a lot shallower here. Cheekbone. Keep big smile again on this side compared to the other. Can you see how she's got scrunch lines here? That's all gone. And blow a kiss for me now. And can you see there's, keep going, more lines on one side than the other. and she's lower on this side.
How do you go about telling them what's available, but where they should start and what might be appropriate?
It all has to start with a great consultation process.
Okay.
So when patients come in to see me, it's almost like getting a debrief. Everything that you need to get debriefed about a patient, I want to know. When I think about my days in medical school, how we were taught and trained to do an ideal consultation, we talked about finding out what the patient needs. So for example, whether it's a skin tumor or whether it's a skin graft on their leg for whatever reason. And then we need to know everything about them.
Okay, so people can't just rush in here and say, I want a bit of this.
Absolutely. So very similar to patients coming in saying, maybe something as simple as my pores are dilated.
Sure.
I have a little bit of redness in my cheeks. I have a touch of pigmentation. And we'll say, okay, we have a plethora of treatments that could work for you. So how do we find out what to really do? We've got to delve deep into a great consultation process.
Okay.
How they even got there in the first place. So I believe in that step. So we can demystify, find out more information, and our mission is to listen. That's my mission.
And then you've got this terrific concept of a treatment ladder. How does that work? How do you explain this to people? Because you've got so many things on offer here.
So I want to make it easy for a patient to understand the options available to them. And I think it's really important for a consumer or a prospective patient to understand that they're in control. They have a choice.
Lovely.
Do nothing is always an option. And that is really key. Whether it's in the NHS or whether it's here in private practice, do nothing is always an option. So we have to give options around that. Let's go to the end of the spectrum. Plastic and reconstructive and cosmetic surgery is always there.
Okay, right up the other end of that ladder, but most people won't want to even...
It may not be
But some
necessary.
might.
Absolutely.
Okay.
And I have fantastic colleagues that I know and I will trust will deliver a fantastic consultation if I needed to. What I do and what we do here as a clinic is everything in the realms in between. When I first started the clinic in 2015, that treatment ladder or that treatment choice was probably a lot smaller.
So why is patient education quite so important to you? Because I know it's absolutely fundamental to everything you do here, isn't it?
Consumers can be consumed and consumers can be confused and consumers can be also very excited. It's all the same thing. So why not help? You know, we're in such a privileged position where we are trained and educated. You come to some of the amazing conferences that I go to, Alice.
Yeah.
And you can see it's such an exciting space to be in.
It's so exciting, but for the consumer, it is confusing. You run your own
Absolutely.
consumer events,
Correct.
don't you, to try and help people understand.
I love to make them immersive. I love to make them experiential. Feel what it's like to have a hydrofacial, have a little bit of lymphatic drainage, come to our treatments and come and see what it's like to have an M-Sculpt treatment, understand what an injectable is. So we actually bring demonstration bars with the types of fillers that we have so that patients can actually see what a hyaluronic acid
And feel
is.
this kind of gel and what it actually, yeah.
It's important if you're going to be investing in it in your skin, in your structure, in your soft tissue, in your bodies. Wouldn't it make more sense to actually see and understand what you're investing in?
Sherina, you've got this extraordinary laser, the Picoshore. Can you tell me a bit about what that does and what makes it different?
Absolutely. This is an exquisite piece of technology, absolutely revolutionary. It's actually a tattoo removal laser.
Okay.
Alice, I haven't brought it in for tattoo removal.
No.
I've brought it in for specifically to treat skin revitalization and
Right.
pigmentary changes. So what the picosecond does is it works on a trillionth of a second. That is fast. So these are the fastest lasers.
That's so fast, yeah.
Fastest lasers on the planet.
Yeah.
So if you think of that concept of having a tattoo, this is going to work so fast that it doesn't have time to heat the skin. So it shatters everything in its sight. It turns it into almost like dust, like sand, and that sand, like pigment, will then get transported into the lymphatic system and get washed away. So this is the body's natural own circulation. It's
Okay.
beautiful.
So if it's that good with tattoos, is it equally good with clearing normal pigmentation?
Bingo. Absolutely. So this is what I brought it in for. As my practice evolved, I was seeing fairer skin patients to start off with, and then naturally we were getting more skin type of mine and darker, and I needed something that was going to go with my practice. We do a lot of high-tech facials, we do a lot of topical skincare strategy, and I've always loved lasers over the last few years, and so this time I wanted something that was going to work bigger, better, and faster. What I love about picosecond technology is it's a non-thermal laser. So when the pigments get shattered, patients love their results. It's ideal for that girl or gentleman with no time for downtime. What I love about PicoSure is the unexpected side effect of collagen stimulation.
Oh wow, okay.
This is that pico revitalization, because what they found in the tattoo removal patients were coming back saying, great, my tattoo's gone, but look at the differences in the skin.
Okay.
Younger, better, healthier looking skin. So what I love about this treatment is that men and women can come in, they can have a stealthy treatment, bang, where the impact is made, the skin is lighter, brighter, and then over the next few months is lighter, brighter, and tighter. Amazing. I call that pico toning.
Pico toning, that's a lovely phrase.
Yes.
You also have some extraordinary body contouring technologies here. Now, tell me about the latest one, the BTL M-Sculpt Neo.
Wow, where do I start with M-Sculpt? I just love it. I absolutely love it. And these technologies have I feel like I've gone into the future, found something and brought it back.
Really?
That's how I feel about the M-Sculpt Neo. And I know that sounds pretty corny, and I'm not paid to say that, by the way. I'm more interested in the why of my technologies, as well as the what it can do, which is the benefit to the patient. So that's what patients want to see. What is it going to do for me? And we're in an aesthetic world. And sure, patients want to come because they want to have a six-pack, they want to have a firmer derriere. I get that. But when you actually look at the true muscle regeneration potential of that technology, you can build up to 25% more muscle in 90 days.
In 90 days, that's pretty quick. How many sessions do you need for that?
4 treatments, each
4
done
treatments?
roughly a week apart.
Okay, and then the muscle goes on building. But the Neo adds in radio frequency on top, doesn't it? So it can also melt any extra fat on the tummy if you want to show off those abs that you're building up at the same time.
Faster.
And is that just 4 treatments as well?
4 treatments again. So how does a company take 2 opposing technologies?
Yeah.
We do a lot of radio frequency for skin tightening. So we think, how do they marry these 2 technologies together to actually perform well in the sandpit and actually do a better deliverable for the patient?
Yeah.
So the science is beautiful.
Yeah.
The physics in which they married it together is exquisite. And then finally the deliverable to the patient, I have it and I love the way it feels. And patients feel that. So when I think about the results that we're getting aesthetically, the patients look incredible. They're also posturally standing taller. So when I think about how we age skeletally, how our skeletal muscles also age, and how, very similar to bone, when we get osteoporotic as we age, we also go through something called sarcopenia as we naturally age.
Age-related muscle loss.
Age-related muscle loss. So as we're losing 1% of our muscle beyond a certain age, 35, 45, whatever, this is a treatment and a technology I feel is going to gain us more strength as we go into our aging and longevity.
You've got a few really great ranges of skincare here, which will be new to most people who are coming into you.
So I use 3 predominantly. I love Eyes Clinical. At the back, you can see I have Universe Skin.
Yes.
And then my hidden target is also the Obagi skincare. Yes.
Serious stuff.
Serious stuff, and they're all brilliant. What I came to understand, what I needed for me when I started to learn more about my own aging and skin science was, we talk about inflammation.
Yes.
I did cancer biology in my master's degree at UCL in 2004, so I understood more about the genetics of aging, the repeated hits that we take on our DNA, the mutations, and that we're constantly repairing ourselves. And over a period of time, with those constant hits and those constant repairs, after a while, we don't heal and we don't repair as fast as we used to. And there comes to what I call the point of no return, whether it's for a skin cell, whether it's a tumor cell, and then we think about our organs. Once we hit that point of no return, that's when we start having disease. Flip it to the skin, that's when we start seeing diseases of the skin, whether it's a broken capillary, whether it's a pigment cell, anything. So if we know it's going to happen, like hypertension and blood pressure and strokes, why don't we use that predictive methodology of aging and start working on the inflammation? So I see a lot of redness, rosacea, inflammation due to sun, sugar, stress, all of those kind of things that are part of our external influences of aging. And I always say to patients, look, if you've got it now, one little bit of redness is like a bad apple on the skin. We need to manage that so that the rest of the skin becomes a lot more healthy. So let's tackle that first. Don't wait till it's too late. At least that way we can repair the process as we go.
So that was a quick chat with Sherina Balaratnam and a look around aesthetics, just to show the sheer breadth of what she's got going on here. Treatments for the hair, for the scalp, the face, the body, and the very high level at which she's doing it all. Lots more on her website. Thank you very much for watching.